Good morning, doctors. Welcome again. Today we are going to discuss about oncology MCQs. A man undergoes a pneumectomy. After surgery, investigation shows hyponatremia. What could be the cause of biochemical change? So answer here is removal of hormonal active tumor. Removal of hormonal active tumor, ectopic ACTH secreting tumor causes hypernatremia and body homeostatic mechanism. Try to lower the level of high sodium and do a lesser degree through the sodium. Remains in hypernatremic level or even it may be normal. This question does not mention any preoperative hypernatremia, so removal of the tumor results in negative sodium balance for time being, which results hyponatremia, while gradually it trends to arise again to normal level. Okay. Clinical picture of breast cancer originated from the mammary duct. Biopsy was done and there were neoplastic cells found. Choose the histological picture of cancer. So here is a small cells with round nucleus scant indistinct cytoplasm lobocarcinoma. Yeah. Now, a 40-year-old woman notices increasing lower abdominal distension with little or no pain. On examination, a lobulated cystic mass is felt and it seems to be arising from the pelvis. What is the most appropriate investigation? Do here CA125 for ovarian carcinoma. You have to perform this. This is the answer, whereas CA153 is for breast cancer, CA199 for pancreatic cancer, CEA for colorectal carcinoma, alpha fetoprotein for liver cancer. So answer here is 125 ovarian cancer is likely diagnosis for which tumor marker is CA125. So choose this. Okay, a 74-year-old man who has been a smoker since he was 20 years recently been diagnosed with squamous cell lung carcinoma. What serum electrolyte picture will be the presence of SiADH? Here is low serum sodium, low serum osmolarity, and high urine osmolarity. This is the answer. Okay. Now, a 72-year-old man is receiving chemotherapy for SCLC. He has fourth treatment 8th day ago. He has a cough with some green sputum but feels well. Temperature 37.6 degrees Celsius. Chest exam, few course, crepitations in the right base, heart rate 92 beats per minute, CBC, hemoglobin 12.5, WBC 1.1, neutrophils 0.6, platelets is 89. Sputum, urine, the blood culture sent for microbiology. What is the most appropriate management? Give the broad spectrum antibiotics IV. Why? Because this is treat the pneumonia first. Broad spectrum IV antibiotics. Diagnosis is lower respiratory tract infection. GCSF subcutaneously the treatment chemotherapy induced leukopenia. Okay. Now, diagnostic cells of Hodgkin's disease are is Reed Steinberg cell RS cells. Okay. Now, yeah, RS diagnostic cells in Hodgkin's disease and Reed Steinberg cell, we can say. Yeah. A 6-year-old man has a pathological rib fracture. He also complains of recurrent infection. BME is done. Labs calcium 2 plus equals to 3.9 millimoles per liter, whereas the calcium normal value in millimole is 1.1 to 1.4, or in milligram per deciliter calcium normal value is 8.7 to 11.3 milligram per deciliter. Okay. What type of cells would be found in abundance in the marrow smear? We see the plasma cells, and this is a case of multiple myeloma. Yeah. Point favors age 60 years, pathological fracture from metastasis, recurrent infections due to B cell dysfunction, manifest as hypogamma globulinemia, numerical and functional abnormalities of T cells, and dysfunction of natural killer cells, IV raised calcium level. Okay, now a 65-year-old known case of liver cancer and metastasis present with gastric reflux and bloatedness. On bone exam, there is osteoporosis. He also has basal consolidation in the left lung. What is the next appropriate step? So, treat pneumonia here first. So, IV antibiotics is treatment. IV antibiotics and PPI. So, correct key is IV antibiotics. Pneumonia should be treated first. A patient presents with long-standing gastric reflux, dysphagia, and chest pain. On barium enema, dilatation of esophagus with tapering and is noted. He was found with Barrett's esophagus. He had progressive dysphagia to solids and then liquids. What is the single most appropriate diagnosis here? This is a case of esophageal cancer. Esophageal cancer. Yeah. Now, esophageal carcinoma, there is dilatation in esophagus which is seen both in achalasia and carcinoma dysphagia. To solid, initially it is very much suggestive to carcinoma, and also Barrett's change is clue of to carcinoma. Okay. Now, a 70-year-old man admits to asbestos exposure 20 years ago and has attempted to quit smoking. He has noted weight loss and hoarseness of voice. Choose the single most likely type of cancer associated with risk factor presents here. So, hoarseness of voice. So, this is a case of bronchial carcinoma. Yeah, bronchial carcinoma, asbestos exposure is a risk factor for lung cancer and also has a synergistic effect with cigarette smoke. Hoarseness can be involved of recurrent laryngeal nerve, and condition related to asbestos exposure is pleural plaques after a latent period of 20 to 40 years. Pleural thickening asbestos latent period is typically 15 to 30 years. Mesothelioma prognosis is very poor. Lung cancer. Okay, now a 50-year-old woman who has treated for breast cancer 3 years ago now presents with increased thirst and confusion. She has become drowsy now. What is most likely metabolic abnormality? So here it's a case of hypercalcemia. Yeah, hypercalcemia. Okay. increased thirst, confusion, drowsiness. There are features of hypercalcemia. Any solid organ tumor can produce hypercalcemia. Here, treated cancer breast is probable cause of hypercalcemia. A 65-year-old female patient was given tamoxifen. Which of the following side effect caused by it will concern you? Vaginal bleeding. Tamoxifen can promote the development of endometrial carcinoma. So vaginal bleeding will be concerned for us. Okay. Now, 60-year-old man presents with lump in the left supraclavicular region. His appetite is decreased and he has lost 5 kg recently. What is probable diagnosis? This is a case of stomach carcinoma. Stomach carcinoma mentioned lump in the left supraclavicular region. His vertical gland has long been regarded as strongly indicative of the presence of cancer in the abdomen, specifically gastric cancer. Okay, now a 57-year-old man with blood group A complains of symptoms of vomiting, tiredness, weight loss, palpitation, exam, hepatomegaly, ascites palpable left supraclavicular mass. What is most likely diagnosis? This is gastric carcinoma. Yeah, gastric carcinoma. Blood group A is associated with gastric cancer. Vomiting, tiredness, weight loss are general feature of gastric cancer. Palpitation for anemia of cancer, hepatomegaly, metastasis, and ascites are a late feature of gastric cancer. Palpable left supraclavicular mass is a vacuole gland has long been regarded as a strong indicative of gastric cancer. 56-year-old lady with lung cancer present with urinary retention, postural hypotension, diminished reflexes and sluggish pupillary reaction. What is the most likely explanation of her symptoms? Lung cancer with urinary retention, postural hypotension, diminished reflex. So this is a paraneoplastic syndrome. Features given is well feature of autonomic neuropathy which can lead to results of paraneoplastic syndrome. Okay, now a woman diagnosed with cancer breast presents now with urinary frequency. Which part of the brain is metastasized spread to? Diencephalon, mainly diencephalon. Diencephalon is made up of four distinct components: thalamus, subthalamus, hypothalamus, epithalamus. Among these, the hypothalamus has crucial role in causing urinary frequency. Now, 55-year-old man presents with history of weight loss and tenesmus. He is diagnosed with rectal carcinoma. Which risk factors help to develop rectal carcinoma except that is high fiber diet is not a risk factor. Okay. High fiber diet except high fiber diet all other are risk factors to develop rectal carcinoma. Good morning. A 32-year-old patient present with cervical lymphadenopathy and splenomegaly. What is the most appropriate option? This is non-Hodgkin's lymphoma. Here only 2 points are mentioned: cervical lymphadenopathy and splenomegaly. This combination makes non-Hodgkin lymphoma. As the most likely cause through splenomegaly is a relative uncommon feature of it. This combination does not fit in their option. Okay. Patient with Hodgkin's lymphoma who is under treatment develop high fever. His blood result shows WBC less than 2800 and has a chest infection. Choose the most likely treatment here. So the best treatment is piperacillin and tazobactam here because this is helpful to treat neutropenia also. Here patient WBC less than 2800 which has leukopenia, probably neutropenia. Piperacillin tazobactam may be used in the management of neutropenic patients with fever suspected to be due to bacterial infection as in a patient post chemotherapy neutropenia. Even febrile neutropenia can be seen in patients with cancer. Okay. 40-year-old man with 25-year history of smoking presents with progressive hoarseness of voice, difficulty swallowing, and episodes of hemoptysis. He mentioned that the used to be regular cannabis user. What is the single most likely diagnosis here? So here the diagnosis is think smoker, progressive hoarseness voice, difficulty swallowing, and episodes of homeostasis. So this is a case of squamous cell laryngeal carcinoma. Yeah, cancer. Chronic hoarseness is the most common early symptom. Other symptoms of laryngeal cancer include pain, dysphagia, a lump in the neck, sore throat, earache, or persistent cough. Patient may be described breathlessness, aspiration, hemoptysis, fatigue and weakness, or weight loss. 67-year-old man with history of weight loss complains of hoarseness of voice. CT reveals opacity in the right upper mediastinum. He denied any history of difficult breathing. What is the single most appropriate investigation? Lymph node biopsy. There is a weight loss and there is opacity in the right upper mediastinum. May indicate enlarged lymph nodes or lymphoma causing pressure on the right recurrent laryngeal nerve, resulting in hoarseness as CT didn't reveal any bronchial lesions and no breathing difficulties unlikely to be bronchial pathology. So CT guided lymph node biopsy can be reveal the diagnosis. Okay. 72-year-old man brought to the ED with onsets of paraplegia. Following a trivial fall, he was treated for prostatic malignancy in the past. What is the single most probable diagnosis? This is secondary. In male, osteoporotic fracture is less common as patient had prostatic malignancy, pathological fracture from secondary metastasis to bone. Here, vertebra leading to paraplegia is more common. Okay. 33-year-old lady with Hodgkin lymphoma presents with the temperature 40 degrees Celsius, left-sided abdominal pain and lymphadenitis. Blood was taken for test. What will you do? Broad spectrum IV antibiotics. Okay. Patient is immunocompromised with signs of infection. Temperature 40 degrees Celsius, left sided abdominal pain, and lymphadenitis. Broad spectrum IV antibiotics should be started empirically while waiting for the blood reports. Okay. 26-year-old woman being treated for carcinoma of bronchus with steroids presents with vomiting, abdominal pain, and sudden falls in the morning. What is the most likely cause? शरीर में गांठ होती है